Awesome. Thank you, Lori. Um, I'll have Teri and I introduce ourselves and we'll just jump right in. I'm Susan Mancheski. I'm the Vice President of our Strategic Customer Group, and I work with all of our businesses across the kind of the largest healthcare systems in the West. Teri?
Hi, I'm Teri Adams. I am the Supplier Risk and Continuity Manager at Intermountain Health, working on our Strategic Supplier Relation Management team, and super excited to be here.
Awesome. I think I'll ground ourselves in our agenda before we get started. We have, I think, 40 minutes or so planned today. So Lori introduced us, and we'll get right into an overview of what HIRC is. And then I'll pass it to Teri, and she'll look at HIRC and provide some insights from a provider's perspective. And then I will talk about it from a supplier perspective. And then we'll open it up for some Q&A. So as we think about supply resiliency and where we were headed is the pandemic and even the fallout from the pandemic, it hasn't necessarily didn't rebound instantaneously. Supply resiliency became obviously actually a household term people were using. And one of my friends who works in supply chain said, for the first time ever, my family finally understands what I do, right? Now they understand what supply resiliency is. So HIRC was created, born out of the common problems and desire for solutions and increasing the supply chain resiliency across the healthcare system in the US. And their mission is really to increase that resiliency and transparency across the healthcare supply chains through collaboration, sharing of best practices, creating standards that we can all agree to and rely on and work toward. And really, it's all about providing that continuity of care for your patients. They do have a set of standards that we have created collectively and that we can agree to abide by and earn certifications to. That includes mapping and monitoring, a resiliency scorecard, and then mapping and monitoring kind of translates into a transparency badge. And the resiliency scorecard would ultimately have a goal of becoming a resiliency partner and earning that standard as well. We'll talk a little bit more about what those mean in just a second. But just to provide a little bit of a snapshot of HIRC, I said it's a not-for-profit, it's a collaborative a group, and it contains some of the largest health systems in the country. You can see on the screen a snapshot of those involved. Might not be most up to date. I mean, we're actually getting new members week in and week out. But as you just kind of scroll across the top, you can see some of the largest and most preeminent healthcare systems across the country are members, and not only members, but are very active and engage in the various councils and work toward creating these standards and sharing of best practices. If you go down the screen a bit, you can see the suppliers that are members and engaged with HIRC. And again, similarly, you'll see probably some of your largest suppliers or most of your largest suppliers as active members of HIRC. Medline, Cardinal, Baxter, BD, Medtronic, Stryker, and that ticks a lot of your boxes, I think. So I think we got the right people engaged with HIRC. At the bottom of your screen, you can see the collaborators that HIRC works with. ARM, of course, is one of them. Also, Gardner Supply Chain Group, SMI, and whatnot. And in the middle right-hand side of the screen, you'll see some pretty important member partners as well. Vizient, Premier, and then Accenture and Clarium do a lot of the nuts and bolts work behind the scenes as we work toward audits and earning badges. Any questions on HIRC as an organization before I move into a little bit of the next level detail about their standards that they've set and badges and accreditations suppliers can earn? Nope, forging ahead. All right, so really there are two kind of main cornerstones of, from a supplier's perspective, and where providers would maybe judge is not the right word, but monitor their suppliers in terms of resiliency. Two main sets of standards: the transparency badge and the resiliency badge. The transparency badge is an opportunity for suppliers to increase transparency around their geographic manufacturing and distribution of critical to healthcare products in terms of categories. And so that as a provider, you can see where these things are happening, and through the HIRC membership and collaboration that they have with SRS or some other monitoring companies, they can provide heads up if they know their member suppliers are making things in a certain geographic location and there is a weather event, like a major natural disaster. They'll provide the information saying, hey, HIRC member, you buy from these categories from these suppliers, they're manufactured in this part of the world, and it just experienced a large earthquake. Heads up. So there's this mapping and monitoring part of the transparency badge. In order for that to happen, suppliers need to put all of this information in a secure vault. And so to earn the transparency badge, you agree that you will put these predefined categories, so not by every SKU, not by every single product that we make at that level of detail, but in common category language kind of buckets. Where do you make these things? Where do you distribute them from and to? And that will then be the foundation for the monitoring and mapping part of the transparency badge and the benefit for HIRC members. It streamlines our communication from one to many. So as the supply chain was becoming a little fragile, we were getting bombarded as a supplier with questions: where do you make this? Where do you make that? I want, for every SKU, where do you make everything? Like, geez Louise, right? Think about a company the size of BD. We make over 70 or 80,000 SKUs in lots of locations. And so it became just an untenable request. We just couldn't keep up with the request. So this allows us to provide the transparency in a one-to-many model where we put it in the vault and all the HIRC members can see it when they would like. And then obviously the whole point of doing it is to reduce event impact and improve recovery if there is a natural disaster or some sort of supply constraint along the way. The second kind of main set of standards that we work with in HIRC is the Resiliency Badge, and that's a new standard that's evidence-based to really provide that assurance to providers that we have the systems in place to recover or provide continuity of care or of products, so you can provide continuity of care as a provider at the product category level. So it's not a risk badge. So it doesn't say if you get this badge, there's no risk in your supply chain. It is a resiliency badge. Do you have the processes in place, the safety stock, the redundant suppliers to manage through some sort of constraint or event? So there's 4 benefits of that resiliency program. Proof of resiliency. I mean, if we set the standard and you meet it, then you can believe that the supplier has the ability to withstand these disruptions. As a supplier, it allows us to showcase our commitment to best practices and innovation and demonstrates our strength in resiliency. It also is a commitment to continuous improvement. So you earn the badge, it's not a one and done. This will be something that you have to renew so you can continue to demonstrate that you've close the gaps, maintain the closure of these gaps if anything was identified in the audit process, and that you remain resilient. Increased efficiency, again, reduces the need for one-off requests from providers and allows you to provide continuity of patient care. So this was an industry-wide effort. It's a newer program, started about, I think, just over a year ago. So maybe there were 24 and 25 partners, and now we're rolling into 26. 50 provider and supplier organizations came together. I actually sit on the Resiliency Badge Council to create the standards of the badge. Refine and review is kind of a constant loop we're working on, and then evaluate its effectiveness and constantly and iterate. And it took 350 specific healthcare leaders were involved or more, and many, many, many hours. If you think from a piece of blank slate, what would you, healthcare leader, think means resilience to you from a supplier, and what for you? And imagine kind of that intake, and then how we went through the process of boiling it down to a standard that we could all agree on that was still robust enough to make a difference. Oh, we have a question.
Yes, hi. My name is
Hi.
Alicia Kangas, and I'm very excited to hear the notes and things you have about the HIRC program. One of the questions that come to mind is kind of goes back to COVID times. Some of these hospitals and IDNs have to reach out at times to third-party vendors for things like rentals and, short-term fixes to some of that census spike. Does HIRC cover any of those type of organizations for rentals, or is it more of just per product?
That's a good question. I don't know of any of the third-party rentals or DME companies that would be members. I'm only aware of manufacturers and providers.
Thank you.
Mm-hmm. And one last slide before I turn it over to Teri regarding the Resiliency Badge achievement. So this is an external audit-based badge. It takes quite a bit of work to do it. It's over 300 audit questions, interviews, documents required. I mean, it's an undertaking. But in the inaugural year, Cardinal Health achieved the badge as a distributor, Medline as well as a distributor, and they've now, which isn't shown on the slide, achieved a badge as a manufacturer for some of their products as well in 25, Medtronic and Stryker. And then BD, Cardinal as a manufacturer, Pfizer, Innovative Health, Baxter, and Solventum rounded out 25 as achieving the badge and going through that process. Currently, B. Braun is in pursuit, and I think that's the most current news that's fit to print. I'm going to turn it over to Teri and talk a little bit about HIRC from a provider's perspective.
Thank you. So I had an interesting journey into supply chain. I come from a large healthcare background, not a supply chain background in my experience. And so jumping into this and understanding some of that has been a wonderful journey. And HIRC has been very helpful in that process as well. I'll tell you a story that sort of really established how I've looked at this and engaged in this process. I remember during COVID, I had the wonderful blessing to manage our mobile COVID testing team for Intermountain Health. I was assigned that as a continuous improvement consultant at the time, and it was an amazing opportunity to sit in a really pressure test environment where every single engagement we were reasserting our processes, making immediate changes, trying the best flows. Let's try this, let's try that. And it was so fun. Nobody wants to say COVID was fun, but that experience of being able to immediately make those adjustments that I could see and make the processes better, make the systems better, and do those things was such a fire for me. I loved that. But my first day in that, we took our RV up to Park City, and we set it up, and we had on the books really gone through what we thought was a great process and system, and we'd set everything. We knew where the line was going to go. We knew how they were going to come up to the windows and walk around and go into the tents and get tested, and we really thought we had it down, and it was not down at all. It was a complete disaster for the first I'll say 4 hours of the day. It was chaos. Our computers weren't working like they were supposed to. The lines were confusing despite all our best efforts to set them up. And I remember Lori, the administrator at Park City Hospital, was there that day, and she walked up to the bus and she said, this gentleman right here has been waiting. He's been doing this, he's been doing that. She went through the process, and I said, he needs to go in that line over there and wait for this. And I was just like thinking of all the processes, and she stopped and she yelled at me, which don't yell at your coworkers, except this was really good for me. She yelled at me. She said, hey, patient first. He is standing here right now. Let's get him taken care of. And I was like, okay, time out. Let's freeze for a second. You are right. We are here to take care of people. We are here to take care of patients. We are here to do what is right by them. Time out. I need everyone to come for a second. We're going to huddle. We are going to talk about this. We are going to find a solution, because what we thought was going to be good is not going good. And we pivoted immediately. We switched. We ended up staying like till 11 or 12 o'clock that night to get everyone taken care of that wanted to be taken care of that day and get our processes better. And it got better. We got really good at it. But the first day was quite an experience. And I remember thinking, you're right. I am in healthcare to take care of patients. And that perspective has been a core of what I do and why I do it. And I think that's true as we jump into supply chain. We are healthcare suppliers. We are here to supply for patients, to take care of patients, and they come first. And if we can't get what we need to them at the right time, that's a problem. They're going to be standing in line, being sent left and right. They're not going to get taken care of. They're going to hurt. They're going to be in pain, or they're simply going to be upset. Either way, we're not getting them taken care of. And we are here to take care of them. If you could jump to the next slide. Many healthcare providers have said the same thing. What do we care about? We care about taking care of what we need to immediately. The Resiliency badge is going to show us who is here to take care of patients and can pivot to make sure we can take care of them right now. But it won't take 4 hours to get them through the first line, right? 75% of them say resiliency has teeth, that's important. 100% of them say that low resiliency will impact costs and will impact patient care. I.e., if you are not resilient, if you are unable to pivot and get me what I need, I'm going to have to pay people overtime to call people to get the stuff that they need. It's going to cost us more to ship it immediately. We're still going to take care of the patient, but I can't take care of the patient long term if it's going to cost me 4 and 5 times to do it. That's not going to take care of my patients in the long term. So low resiliency is going to impact my cost. 80% of them say that resiliency is going to be an important role in our sourcing, and 90% will make a big impact in sourcing. 75% say that strategic suppliers must obtain their badge. That doesn't mean that every supplier has to have a badge to do business with us yet, but that the ones that we care the most about will have to, or we simply cannot put as much money into that. It's not worth it. So providers are coming together in HIRC as a single unit to say, we care about patients, we care about being able to pivot, and we care how that's going to impact them. And we want suppliers that do the same. We are going to make sure that that is a standard in what we are doing. And if everybody has a different standard, we can't play in the same sandbox. It doesn't make sense. And that's what we do together, is we come together frequently and we say, hey, has anybody thought about this problem? What do you do about that? Has anybody asked a supplier what they do about this? Because we're struggling to figure out what to do. And they say, hey, if we can ask the same question, then we can get the same results that we need. We need to do that. Let's get that together. So as a provider perspective, this matters so that we can take care of our patients. Next slide. Obviously a lot of voices on the resiliency badge. My hair used to be longer. I don't know if you guys see that, but that's a fun picture from the last Vision conference. But yes, it plays an important role in our strategic sourcing, and we're not the only ones. Being able to come together and hear that other people care about this, that healthcare organizations across the country will be looking for these standards in those that they engage with. What does that standard mean? How do we engage with that standard? Quality, safety, price, all of those are important, but we can't do what we need to do if you can't get us what you need to get us. And so we need to make sure that we're asking the right questions to get those expectations in standards. And you can see that there are several providers across the country that have wonderful things to say about that. Next slide. Not only is it just those that you can see, to ensure that all healthcare providers, all healthcare supply chains are thinking about resiliency and risk in an important way. We have been able to get in with Gartner, actually. I'm sure many of you, if not all of you, have heard of our top supply chain Gartner statuses across the industry. Gartner has already said right here that all of these things are important. All of these things are important in figuring out our quality of patient care, resiliency, etc., across the industry. But you can see an entire 5% has been allocated at this time to just risk management, to just watching for resiliency. And if healthcare providers don't care about the resiliency of our supply chain, that affects an effective supply chain in a supply chain management. But what goes into that 5%? Next slide. It's your HIRC engagement. It's being engaged with HIRC. It's doing the things that we need to do. Those standards that have been established as a part of that process, that is what weighs into an entire 5% of your Gartner supply chain score. So are you engaged with HIRC? Are you an active member? Are you attending your councils? There are several councils where you have the opportunity to impact the standards that are established across the industry. Are you engaged in those councils? Are you engaged with other providers? Are you engaged with talking with suppliers in that process? A third of this also goes into, are you resiliency accountable yourself, right? It's not just, hey, do we show up, but do you have your own business continuity management plans? Are those the same as what we set as the standard in this process? Do we submit our resiliency data to HIRC? Are we asking the questions to others in the industry, et cetera, et cetera? And then are we doing what we need to do to expect resiliency and respect the standards that have been established? So have we implemented those standards with our suppliers? And what are those standards? Next slide. Those standards are we asking in our RFPs and our sourcing, in those contracting negotiations and those questions, are we asking, do they have these badges? Do they engage in these standards? Do they know what we're talking about? Can they prove to us that they have a resilient supply chain? Are they sharing their data, their mapping, their monitoring? Are they transparent in that process? And if we are not asking those questions, then we're not up to standards. We ask them and discuss them in our business reviews, in our scorecarding. Every time we engage with a supplier, we show them, hey, you have a score because you have shown us that you are doing well. Thank you for being a good supplier for those things. Let's talk about some other things. Or we are saying, excuse me, supplier, you have not shown that you can live up to your standards yet. Here is what we are looking for. I want the transparency badge. I want the resiliency badge. I want you engaged with my mapping and monitoring process. I want you to be telling me what's happening in the systems. If you can't give those basics, then you're not scoring as well. I'm sorry. And you can't be a strategic supplier. So those are our business reviews, our scorecarding, those engagements in that process. And then we also have the opportunity to get together. This year, it's actually something new, so I can't tell you how effective it is or not. I expect it'll be great, but we want to make sure that just those that have heard of us the first time are not the only ones living to these standards. These are meant to be national standards. We have those that actually are talking to Congress when questions arise about healthcare resiliency. They look to HIRC and others in that process, and we want to make sure that we get those standards and expectations out and understood, and that if there's better expectations or standards, that we hear about them, that if somebody is doing something better, that we know, and that we can do what is best for our patients and for those that are around us, because that's what we're here for, and that's what we're in for. And as a provider, being able to have a resilient supplier is essential in that process. Back to you, Susan.
Thanks, Teri. One quick question. You guys at Intermountain are out front in this whole HIRC thing and have been just really an important member and developer of programs and then implementer. Can you share where you're at? So we get a lot of RFPs and we're starting to see, are you a HIRC member? Do you have a transparency badge or a resiliency badge? So as a supplier and somebody who's an active member of HIRC, nothing makes my heart sing than that, right? But my next question is, when and how is this going to make a difference, right? Besides just asking the questions, right? Our ultimate goal, and this really is going to work, is when it makes a difference that a supplier has that badge, transparency badge or resiliency badge, in your decision making. So you're gathering the information, you're asking the questions. Have you moved to the step of implementing it into the actual decision making process yet at Intermountain?
Yes, it is a part of the decision-making process. It's not an exclusionary decision-making point
Mhm.
at this time, but it is a point. So it's in the process as to who we consider strategic, and that level of a supplier gains access to our organization, gets information, gets to talk with our chief executive officer, those types of things, if you have those things. So it goes into our scoring of a supplier. And that has already been established as far as those weights go. And it has been put in the RFP process. Right now, it's just being given points in that process in conjunction with other things. And the weighting of that depends on the RFP at this time. So it's not yet quite standardized as it's a full 5% or 20% or whatever that percentage is yet. But it does make a difference. So if I have two suppliers who have a quality product, who are giving me the same great pricing, who are doing all of those things, and one of them has a badge and one of them doesn't, I'm going to go with the one with the badge because that point is better. Because they can make sure that that product is supplied to me when something happens.
Great. I love it. We're going to shift and pivot a little bit, and I can look at HIRC and share insights with you from a supplier's perspective. And so for the suppliers on the call today, why engage with HIRC as a supplier? I think it'll simplify how you tell your story. It is a chance to demonstrate your competencies and really differentiate yourself. I mean, you could hear from Teri, and this is why I asked, what? Like, it's a lot of work. I'm not going to downplay the effort to get these badges and maintain that kind of rigor. But this is your chance, right, to differentiate yourself and the work that you've put into your supply chain. And then as an engaged member, you get to add your voice as standards are developed and refined. I mean, you heard Teri talk about that. And there's various councils and committees to sit on, and they're very active and they're very collaborative. And you can gain unique access, to your voice of customer. Whether it's the access that Teri referenced in the RFP to those strategic suppliers that do have a resiliency badge or transparency badge, it's also an opportunity in these council meetings or at the HIRC Academy, which is a new program we're putting on this year, as Teri referenced, to engage with your peers, whether it's your peer suppliers or your peer customers, and get their insights and best practice sharing. I mean, it's a very, very collaborative group. And lastly, of course, learn best practices from your peers. So why you're in the resiliency badge? I mean, HIRC has done a bunch of good work in surveying voice of customer on their side, and 3 in 4 providers say that the badge and executive summary give them some proof, right? 9 out of 10 HIRC providers say the resiliency badge will have a meaningful impact on bids, awards, annual reviews, and avoiding redundant information. I have seen not only are you a member or whatnot on RFPs, but if you check yes, the entire questionnaire collapses. So the next 25 questions that you'd have to answer if you didn't have your resiliency or transparency badge, it goes away if you check yes. And so this is the efficiency and the robustness of these badges and standards that we have at HIRC too. It gives you that kind of confidence. If we check yes, we don't have to answer the 25 more questions. And then 75% of providers say it's really important for their strategic suppliers, to Teri's point, in particular, obtain that resiliency badge. If you're one of the top 3 or 5 suppliers for a large health system, you better have some resiliency badge in place, right? And it is puts your providers and your customers in a pickle if you can't provide them what they need to provide patient care. I think that my point is it matters, and I'm seeing that. I mean, we more and more each day are seeing that it does matter, and these standards are being adopted. I'm proud to say that BD earned a Diamond Resiliency Badge this year across all 7 domains. So that Resiliency Badge that I referenced isn't just kind of a generic, are you resilient? It goes through inventory management, demand planning, supplier management, risk management, and contingency planning, operation health, the visibility of our supply chain operations, and then logistics. And you get a rating in each one of those domains. And so we had Diamond across all 7 domains, and then resulting in an overall Diamond badge for BD. But to give you a sense of how much work this takes, we kicked off the work in December of 24, and it took 6 months of preparation to answer over 300 audit questions with supporting documentation required, which meant legal review and upload into an encrypted secure vault. And then 1 full week of full days of external audit review happened in June. They identify gaps, and then you have agile remediation if it's things that they just needed to ask more questions about, or short-term kind of easy gaps that we could fix. You have a chance within 2 weeks of your audit to come back and demonstrate competencies before they make the final judgment award. So thinking about the size of the organization is probably not the most realistic thing for your smallest suppliers to do, but also the flip side of that coin is for a large supplier, this is a lot of work, but we found it very, very worthwhile. Certainly aligns with our commitments to continuous improvement and supply chain resiliency, and allowed us to bring forward our competencies and shine a light on them. So it was a really positive experience for us. And then also, we've been a transparency badge partner for 4 straight years since it has started, in underscoring our commitment to being transparent and sharing information when we have it, when it's needed. And so I think that ongoing commitment, our engagement in HIRC as an organization and as me personally, has been so valuable that I couldn't recommend it more for a supplier. Are there any questions you have for Teri or me?
So an organization can log into HIRC to see who all has these badges. And
Yes.
do they have
Yeah.
to have a membership, or can they just join?
To see the
No,
badges, you don't need a membership. The website is open for anyone to view who is engaged in HIRC and who has badges and what years those badges were last received. That's just on their open forum. To be a member or to engage and ask questions of other HIRC members, to join the meetings and have access to those resources, you have to be a member of HIRC. But just to see what they have or what those standards are, that's on their open website.
Great, thank you.
Thanks, Lori.